Hello, this presentation is called Crisis Theory, Intervening in a Time of Need. We are Group 3, and we are made up of Kristen Kenny, Nicole Brand, Victoria Cox, and Kat Rose. Thank you so much, and I hope you enjoy the show.
Hi, my name is Kristen Kinney, and I am here to talk to you about crisis theory. Crisis theory is based off of four main principles. 1. Crisis intervention is time limited and short term. 2. Engagement and assessment occur simultaneously and efficiently. 3. A fundamental process of crisis intervention is to meet concrete and emotional needs through the provision of services. And lastly, 4. The crisis intervention must move quickly, seeking to help a client to return to previous levels of functioning. A crisis is an event that leads to a temporary state of psychological disorganization or of inability to function as one ordinarily might. This is where a social worker can come in and be an agent of change through crisis intervention. The theory puts heavy focus on resiliency and focuses on the next steps in a quick and effective manner. While the situations that cause crisis typically cannot be prevented, a savvy social worker should essentially be able to turn negatives into positives and empower the client.
Hello, my name is Victoria Cox, and I will be doing the examples of practice settings that crisis theory can be used in, including diverse client systems. When working with individuals who are in crisis, the first and foremost step before doing an assessment or identifying the problem is to provide a safe place for the client to go, a place where confidentiality is present and judgment is not. Some practice settings that could be used for crisis intervention can include hospital rooms, crisis centers, counseling centers, mental health clinics, schools, correctional facilities, and social service agencies. There is also national 24-hour hotlines that are available and are designed to offer immediate assistance for crises related to suicide, domestic violence, sexual assault, and drug and alcohol addiction. Some settings are not the most convenient or obvious. Take Hurricane Katrina, for example. People were forced from their homes and were left without basic needs and essentials such as food, water, clothing, housing, transportation, hygiene products, and medical care. The entire nation rallied to their side, including social workers, to provide crisis intervention along with other services. Crisis intervention was being offered at homeless shelters, temporary housing facilities, convention centers, and warehouses that opened their doors to those who lost their homes. A diverse client system is a part of the in-person environment. Client systems can include immediate family members, extended family, close friends, support systems, which can include other mental health professionals and or the community. Diverse client systems can vary from individual to individual, from family to family. Whether it's dialect, a language barrier, certain beliefs, or more upbringings, each client system needs to be approached with an open mind and understanding. If you have a client in crisis, often the client system is going to be an essential part of emotional and mental recovery. Even if there is no immediate family available, a strong support system is extremely important. At times when family or friends are not around due to certain circumstances, the client may have a team of mental health professionals that they can call on for guidance. If you are able to reach out and connect to those mental health professionals with the permission of the client, of course, it can help the client resolve that current crisis or at least give the client the tranquility in knowing that they have the support that they require.
Again, my name is Nicole. Over the next couple of slides, we will be looking at some of the strengths of crisis theory. One of the biggest strengths of crisis theory is that there is flexibility over the 7 stages. The 7 stages are 1. Assessing client safety and lethality, 2. Building rapport, 3. Problem identification. 4. Addressing client feelings. 5. Generating alternative options. 6. Developing an action plan. And 7. Following up. These stages can be adjusted to best fit client needs. In stage 1, the social worker will determine whether the client has any biological, social, or psychological stressors, and determine whether a suicide or homicide attempt has been made, or whether the individual is a target for domestic abuse or any other threat of harm. In stage 2, it's important to make sure that the social worker and client build rapport with each other. In stage 3, the social worker will work to determine what the problem is alongside with the client. In stage 4, the client and social worker will explore and address feelings surrounding the problem. In stage 5, the social worker and client will discuss and practice different coping skills. In stage 6, an action plan is developed to help move the client past their current crisis. In stage 7, the social worker schedules a follow-up session with the client to determine progress and determine if any other referrals are needed. Again, there is flexibility in these stages for the client and the social worker, and can be best addressed to fit client needs as they arise throughout the initial meeting and subsequent meetings. A second strength of crisis theory is that it's a very easy model to use. It's also very straightforward. The idea is to be brief and to develop goals with the clients and help with solutions that will help them move through their crisis as quickly as possible. A third strength is that the models and protocols are adaptable to many different situations, as crises will differ from person to person.
Hi, my name is Kat Rose, and I will be speaking about the limitations of crisis theory. Some of the limitations include a lack of working knowledge about the client. When we're dealing with crisis theory, sometimes we aren't able to get into the lifestyle, their personal private logic, in-depth family dynamics that are occurring or have occurred, also the community undercurrents that were previously there before the crisis. Continued crisis theory limitations include that the crisis theory generally does not focus on adaptive or maladaptive practices. This is because it's more of a general crisis theory approach. Some limitations may include generalizations that do not meet the specific needs for each client based on previous history. So if they have a history of other type traumas or specific events, it will be more of a general type crisis intervention rather than a more specific for that person individually. Theory is also based on crisis and does not address specific individualism, and the generalist approach could be too broad for some suffering with past trauma. Crisis theory works within a limited time, and sometimes this prevents an issue for such clients or patients that are dealing with past traumas or maybe have a mental illness of some sort. More time may be needed to handle the crisis than what is given. Further interventions may be necessary, and a new treatment team that might be taking over because the limited time with the crisis theory may cause a delay in healing and make the overall process a little bit more difficult on the client. Another big issue when dealing with limitations of crisis theory is that the crisis theory is difficult to document and measure. The results are hard to see. This happens because not all crises are the same, and different interventions are used, such as individual or group therapy. Also, applications vary due to training and expertise. So a person could be trained in a completely different way, and maybe some are not as quite expert as others. It's just hard to know what the results really are when it comes to dealing with crisis theory. It is very difficult to document and measure. And this has definitely been one of the limitations to using crisis theory in the past.
Thank you again, and here are our references.